So let us discuss the next hormone in this hormone and hormone antagonist unit, in which pharmacology of thyroid hormone. Firstly discuss about the thyroid gland. The thyroid gland, they secrete a thyroid hormone. Thyroid gland, it is situated at the base of throat, having the two symmetrical lobes, one on either side of trachea. Trachea, it is part of respiratory system. So in this part of in the side of trachea, there is two symmetrical lobes are present, and on which on the throat base, and here throat thyroid gland is present. So thyroid gland, it is situated or located at the base of throat, having the two symmetrical lateral lobes and one on the either side of trachea. They are joined by the thin portion of thyroid tissue. This thyroid gland and this trachea, they are joined by a thin portion of thyroid tissue, and this thyroid tissue is known as isthmus. ISTHMUS, isthmus. So the thyroid gland, it is synthesizes two important hormones. ही जी thyroid gland आहे ही दोन important hormones synthesize करते, that is thyroxine and triiodothyronine. Thyroxine and triiodothyronine. About 90% of the body iodine is present in the thyroid gland. 90% of iodine, body iodine, it is present in the thyroid gland, and mainly it acts as a organic iodine. So this is location of, this image shows the location of thyroid gland. It is situated at the base of throat. Here, trachea. So there are two symmetrical lateral lobes. This is first and second. These lobes are one on the either side of trachea. म्हणजे इथून ट्रॅकिया असते आणि ट्रॅकियाच्या दोन्ही साइडला हे लोब सिच्युएटेड केलेले आहेत, आणि ए थिन पोर्शन याला जॉईन करतो ट्रॅकियाला आणि ह्या ग्लँड्सला, दॅट इज थायरॉइड टिश्यू, and it is known as isthmus. Here trachea, then thyroid cartilage, this is thyroid gland, clavicles, sternum, and parathyroid glands. Screen is visible to all?
Yes, ma'am.
Yes, ma'am.
Okay, so thyroid gland, it secretes the two secretions or two important hormones. First one is thyroxine and second triiodothyronine. Then parathyroid glands, they are again their location, they lie just behind the thyroid glands and in the neck. म्हणजे thyroid glands just behind. दिसतं का location parathyroid glands?
Yes,
Okay, so parathyroid glands, they are light pink in color and they produce parathyroid hormones. Thyroid gland produces thyroid hormone, and parathyroid gland, they produces parathyroid hormone, and this hormone increases the level of calcium in the blood, and they are pea-sized glands. They are located in the neck just behind the butterfly shape of thyroid gland. Butterfly माहिती है, like this shape of this thyroid gland. Then next point, it is secreted by thyroid hormone. It is secreted by thyroid gland. Then location of thyroid gland, it is situated or located at the base of throat, having the two symmetrical lateral lobes, and they are on the side of trachea, and they are joined together by a portion is isthmus. And this gland secreted two major hormones such as triiodothyronine and thyroxine. Thyroxine, it is T4, and triiodothyronine, it is T3. This is controlled by primarily TSH. TSH is thyroid stimulating hormone, and it is secreted by anti-pituitary glands. So this thyroid hormone, it is controlled by primarily TSH. TSH, it is thyroid stimulating hormone, and this TSH, it is secreted by anti-pituitary glands. Glands also secrete calcitonin, means this thyroid glands, calcitonin जे important हार्मोन आहे मेटाबॉलिझम साठी, कॅल्शियम मेटाबॉलिझमसाठी किंवा कॅल्शियमची लेवल जी आहे ती इन्क्रीज किंवा मेंटेन करण्यासाठी जे हार्मोन responsible असतं that is calcitonin. So in this thyroid hormone, thyroid gland secrete mainly major hormones such as thyroxine and triiodothyronine, that is T3 and T4, and also it secretes the calcitonin hormone. So mainly it is secreted how many hormones?
Two hormone.
Two hormone.
Major hormones are first two, but totally
Three
किती
hormone.
करतात? 3.
Three.
Calcitonin, T4 and T3, triiodothyronine and thyroxine. The next point. So this is about thyroid gland. Secretion. जसं आपण इन्सुलिन मध्ये pancreas, their alpha cell, beta cell secretion बघितलं. And after that start the pharmacology. So by this way here, this is about thyroid hormone, their secretion. Then in which thyroid glands, it secretes this mainly three hormone, calcitonin, thyroxine and triiodothyronine. Out of these three hormone, in which about the 90% of body iodine it is present in the thyroid gland. Thyroid gland मध्ये 90% मध्ये जे body iodine आहे ते present असतं and mainly it act as a organic iodine. Thyroid hormones हे कशासाठी essential आहेत? What is their role? So thyroid hormone, they are essential for physiologically for the growth, metabolic action, metabolism साठी helpful आहेत. Then they stimulate the rate as well as force of contraction of myocardium. Myocardium means related to which activity?
Heart.
Okay, so firstly, this hormone having the essential role in the metabolic action, in the growth, they stimulate the rate as well as force of contraction in myocardium. Force of contraction, it is termed as chronotropic or inotropic?
Inotropic. Inotropic.
Okay, so next point is it also shows important or essential role in calorogenic action. Calorogenic means energy related, or it is a calorogenic hormone. Thyroid hormone, it is a calorogenic hormone. That is, this hormone results in increase the uptake of oxygen in the cell, and this causes increase in respiration and production of ATP. म्हणजे ATP चं production increase करतं. That's why it having the important role in calorogenic action, and also it is responsible for myelination of nerve fiber. Nerve ending myelination connective tissue मध्ये आहे. So this thyroid hormone, it is responsible for myelination process. That is, it is a process in which there is produced the myelin layer in neuronal axons. Axons माहिती आहेत का? Connective tissue मध्ये axon terminals. माहिती आहेत का? axon terminal, nerve endings. So this myelination of nerve fiber, त्याच्यासाठी हे हार्मोन essential आहे. Then next point, thyroid hormone are essential for substitution therapy in cretinism. What is meant by cretinism? Cretinism माहिती आहे? आयोडीनची डिफिशियन्सी असल्यावर जे डिसऑर्डर होते, that is cretinism. So iodine त्या substitution therapy as a substitutional or supplement therapy for cretinism disorder. Cretinism, it is a disorder which is characterized by there is deficiency of thyroid hormone or thyroid or iodine. So त्याच्यामध्ये हा हार्मोन essential आहे. Also it is used to treat the goiter disorder माहिती आहे?
Yes, ma'am.
Yes, ma'am.
Goiter disorder, it is caused due to
Iodine deficiency.
आयोडीनची जर का डिफिशियन्सी असेल तर जे डिसऑर्डर आहे that disorder is termed as goiter. So in the goiter disorder these thyroid hormones are essential. goiter disorder मध्ये काय होतं, there is swelling of the neck swelling होतं and which is resulting enlargement of thyroid gland. म्हणजे neck swelling झाल्यामुळे thyroid gland ची enlargement होते. So त्याच्यामध्ये thyroid hormone हा essential आहे. So first one, it is substitution for the cretinism. Cretinism, it is a disorder in which there is deficiency of thyroid hormone. And the next point, it is used to treat the non-toxic goiter. Goiter disorder जे आहे ते treat करण्यासाठी हा हार्मोन essential आहे. Goiter disorder काय आहे? There is swelling of the neck and because of this there is enlargement of the thyroid gland. The next point, it is also used thyroid hormone. It is also essential or used for the thyroid separation test. Means any individual, if there is disorder of thyroid, for this test is performing, and for this test this hormone is essential, that is thyroid separate for essential for the thyroid separation test. The next point, it is essential as a serum cholesterol lowering agent. Cholesterol means related to which protein or fat?
Fat.
Okay, so ती level lower करण्यासाठी thyroid hormone essential आहे. So these are the essential roles or physiology of thyroid hormone and their location and their secretion. The next point, if there is inadequate, मतलब insulinचं secretion properly नाही झालं, after that it does not perform their proper functions, then it leads to disorder. Like that, if there is inadequate secretion means proper secretion नसेल किंवा excessive secretion असेल हार्मोनचं, at that time it leads to certain clinical disorders or clinical conditions such as hypothyroidism or hyperthyroidism. म्हणजे जर का excessive secretion झालं, at that time it leads to hyperthyroidism. And if there is inadequate, improper secretion of thyroid hormone, then it leads to hypothyroidism. Hypo means increase or decrease, low or high.
Low.
Low.
So thyroid hormone secretion मध्ये जर imbalance झाला, then it leads to some clinical conditions or some clinical disorders such as hypothyroidism or hyperthyroidism. So let's discuss next point is disorders in which hyperthyroidism. So hyper means increase or decrease?
Increase.
Increase. So hyperthyroidism, it is a disorder which is occur due to the excessive secretion of thyroid hormone. If there is excessive secretion of thyroid hormone, which result in a clinical condition is known as hyperthyroidism or also thyrotoxicosis. What is meant by thyrotoxicosis? This is side effect which is already discussed in previous chapters. Thyrotoxicosis. At that time, I told you what is meant by thyrotoxicosis.
Increase in thyroid secretion.
Yes, repeat again.
Increase in thyroid secretion.
Okay, so it is a condition in which there is too much thyroid hormones is secreted in the body. So this is again same as that of hyperthyroidism. So in this disorder, so hypothyroidism, it is a clinical condition. It is occurred due to there is excessive secretion of thyroid hormone and it results the disorder. The disorder is known as hyperthyroidism. Hyperthyroidism, it is a set of disorder that involve excessive synthesis and secretion of thyroid hormone such as T3 and T4. म्हणजे थायरॉइड हार्मोन्सचा रोल त्याच्यामध्ये मेन जे हार्मोन्स आहेत T3 and T4 त्याचा थायरॉइड हार्मोन्सची रिलेटेड रोल आहे. And also thyroid gland secrete another secretion that is calcitonin and their important role in the calcium secretion. So by this increasing secretion of T3 and T4, the disorder is occurred. It leads to hypermetabolic condition. That condition is known as thyrotoxicosis or hyperthyroidism. Then Hypothyroidism, it can be discussed into the two major forms. मग ते hyperthyroidism झालं तर एक तर ते in condition, दोन condition मध्ये present असते as a goiter म्हणून. Goiter means there is swelling of the neck. Then second is Graves disease, GRAVES, Graves disease with the exothalamus goiter. So this hyperthyroidism, it is discussed in the two conditions. Either it is in the condition of toxic goiter or another condition is in the form of Graves disease or Graves disease with the exothalamus goiter. Then symptoms. This condition, hyperthyroidism, that is excessive or more secretion of hormones, thyroid hormones is excessive secreted in the thyroid gland, then it leads to hyperthyroidism. And if this hyperthyroidism, it is observed either in the form of toxic goiter or in the form of Graves disease with the exothalamus goiter. So symptoms of this hyperthyroidism, their symptoms. Screen is visible to all.
Yes, ma'am.
Yes, ma'am.
Fatigue, weight loss, sensitivity to cold. Means individual sensitive to cold, common cold. Then depression, memory problems, goiter, then hair loss, muscle pain, trembling hands, and infertility. These are the symptoms observed when an individual suffer or susceptible to the disorder like hyperthyroidism. What are the symptoms?
Fatigue, weight loss, sensitive to cold, depression, memory problem, goiter, hair loss, muscle pain, trembling hands, infertility.
So goiter, it is an enlargement of a thyroid gland. So when hyperthyroidism disease or disorder is occur, then it is characterized by fatigue, weight loss, sensitivity to cold, then depression, memory problems, goiter, hair loss, muscle pain, trembling of hands, and infertility. Also, it leads to their symptoms when hyperthyroidism is occur in an individual. Then symptoms are occur like excessive sweating, tremors. Tremors माहिती आहेत? Tremors. Epilepsy मध्ये झाले की नाही?
Yes, ma'am.
Yes, ma'am.
What is mean by tremors?
Repeated.
Speak loudly. Tremors means can anyone tell what is mean by tremors? Tremors are the symptom. They are observed in the hyperthyroidism patients. So what is mean by tremor? It is involuntary response, involuntary movement, sudden involuntary movement of body is known as tremors. Then hypertension, palpitation. What is mean by palpitation?
Irregular heartbeat.
Irregular heartbeats. Then tachycardia. What is mean by tachycardia?
Increase in heart rate.
Irritability, fatigue, thyroid enlargement. So these are the symptoms that are observed in the patient having the hyperthyroidism disorder. Then trembling of hands, trembling hands. काय असेल याचं meaning? Any idea? Yes or no? Symptoms समजतात का when any individual suffer to the hyperthyroidism disorder, then it shows the symptoms such as fatigue. Fatigue माहिती आहे?
Yes, ma'am.
fatigue, weight loss, sensitivity to cold, depression, common symptoms आहे. Goiter, memory loss, hair loss, muscles pain and trembling hands. समजते का? Trembling hands and infertility. म्हणजे हँड्सचे जे मुवमेंट्स आहेत त्याच्यावरती काय तो कंट्रोल होतो किंवा देर इज स्लो मुवमेंट दॅट इज ट्रम्बलिंग द हँड मुवमेंट. सो ट्रम्बलिंग द हँड अँड इनफर्टिलिटी. व्हॉट इज मीन बाय इनफर्टिलिटी? Then next point, sweating, tremors, weight loss, excessive sweating, hypertension, palpitation, and tachycardia. Then thyroid enlargement. These are the symptoms of hyperthyroidism disorder. Hyperthyroidism, it is also known as
Thyrotoxicosis.
Thyrotoxicosis.
thyrotoxicosis. Infertility, that is inability to fertile. So these are the symptoms of hyperthyroidism. So he disorder treat करण्यासाठी जे agent use केले जातात. So to treat the disorders of thyroid hormones, or they occur due to either inadequate secretion of thyroid hormone or excessive secretion of thyroid hormone. This disorder treated by any using agent. These agents are known as anti-thyroid agents. So next chapter in this unit is anti-thyroid agents, in which these are the pharmacological agents. When they are administered, they manage the symptoms of thyrotoxicosis effectively, or they are used to treat the thyrotoxicosis, or these are the pharmacological agents they are used in treatment of hyperthyroidism, is known as anti-thyroid hormone. इथपर्यंत समजलंय? Up to this, clear all the points?
Yes, ma'am.
Thyroid hormone, their secretions, what is role of thyroid hormone in the body, and if there is excessive secretion of thyroid hormone, it leads to which disorder, and inadequate secretion of thyroid hormone, it leads to which disorder, that is hyperthyroidism and hypothyroidism, this disorder. And what happens in this disorder, that is in hyperthyroidism, there is increased level of T3 and T4 gland, T3 and T4 hormones, and which leads to this disorder. Then which symptoms observed in this disorder, म्हणजे symptoms त्याच्यामध्ये ऑब्झर्व होतात. देन नेक्स्ट पॉइंट काय येणार आहे त्या डिसऑर्डरचा? ट्रीटमेंट. मग त्याच्या ट्रीटमेंट मध्ये दॅट इज मॅनेजमेंट और ट्रीटमेंट ऑफ दिस disorder by using anti-thyroid hormone. So their treatment we will discuss in the form of chapter, that is anti-thyroid agent. So their classification and mechanism of action, how they act to treat these disorders of either their secretion increases or decreases by this T3 and T4. Then this disorder treated by using this agent. These agents are known as anti-thyroid agents. So remaining points, anti-thyroid agents. This agent, their classification and how they act to treat this disorder, we will discuss in our next lecture. Up to this, any doubt?